All right, so back to team. We do three different things inside of our team as far as communicating with one another outside of just normal business hours. We do team huddles. Those are in the morning. We have 2 shifts, 4 days a week. We'll do a morning huddle. We'll know what ROS, we'll know what new patients we have for that morning. If we've got progress exams, maybe we have somebody need some extra attention. We used to do a huddle before the afternoon shift. So those are pretty short, sweet. We kind of do our own thing. We just kind of huddle around the screen, and we look at the schedule and we figure out what we need to do and who needs to go where. So do a huddle. You need to kind of be prepped for the day. Second thing is we do a team meeting. We do those every Wednesday. That's where we cover numbers. That's where we look at patient visits and collections and OVA and all the metrics that we look at to see where our practice is. And so that is that. We also address any events that we may be having coming up, any schedule changes, calendars, any problems, potential problems in the practice, we do effed up, fired up, so fucked up, fired up, we do that. So tell me something that's not going the way or something we can improve on. Tell me what didn't go well. And then we end it on a high note. Tell us something you're fired up about and what gets you excited. Use it as a patient testimonial or patient story. So we get everybody to kind of share around the horn, and then we're done. We keep it super sweet, short and sweet. Don't make your meetings drawn out and long. Nobody wants to sit in a meeting or on a Zoom call when nobody's talking about anything. So make them short, sweet, to the point, effed up, fired up, do that around the horn. It's just a great energy, and then we leave. Usually those take within 30 minutes. We'll look at our numbers, we'll look at our goals that we have, and see where our targets, how close we are to hitting them. And then the last thing we do is team trainings. We usually do those Friday morning. We don't work on Friday mornings as far as seeing patients, but that's when we can train uninterrupted. Sometimes we'll do that at lunch too if we need to. If we got a new person, we need to really bring them up to speed. But Fridays is our training. That's where we listen to calls. Our voice over internet phones, we can record calls. So we can listen to, like, what was that new patient phone call like? A lot of times we'll have them record their day 2s or their day 1s, and that way we can break them down and see what your people are saying. You might be shocked, especially on the phones. Your phones are where you make your money. That's where you call your leads. That's where you convert people. That's where new patients are calling you. So make sure that you have some level of oversight on those talking points, on that communication that's going in and out of your office. So we use Fridays to break down video or break down audio a lot of times. The other thing is we just role playing. You know, it's better to role play and handle really hard scenarios on Friday than have it happen live on Monday. And so that's from finances to scheduling to everything that we under the sun. You should be training, especially if you're new at this or you got a new team, you have to train them. You're only as good as your systems. And if you don't have a system, you need to get one. Hopefully that's why you're here, to get some better systems. That way you can have the best team in the world, but if you don't have systems, you can't leverage them. And that's what this is all about. It's getting the most out of your team so you can be productive. So have some regular meetings, have some huddles, and then certainly you got to have some training. You got to train harder than you practice. So do this. There's no office that's successful that does not train. So get after it. We'll see you on the next one.